Good day, everyone. I'm Chris Mark Narganza, a first year student, taking a Bachelor of Science in Electrical Engineering program in Western Institute of Technology. Today, I will share to you my advocacy about COVID-19 and related to globalization. This time of the year is meant to be a time of celebrations. However, it has been difficult for many of us to feel excited when it has become a collective of mourning and sorrow. Through the lens of my existence, I wonder how it feels to see the world falling apart through my very own eyes, seeing endless amount of difficult situation, pain, and helplessness that have been felt through our nation due to the emergence of the unseen threat, the COVID-19 pandemic. Now, I ask you, my fellow young people, how do you feel right now? Is everything alright for you? What proper solutions could be considered to reduce poverty in time of COVID-19 pandemic, particularly in ensuring access of food and water? Well, as a young advocate or concerned citizen, we know that we are passionate about making the world a better place for everybody. Poverty is priority. This advocacy is dedicated to the world's citizens whom suffer poverty in which are struggling in the midst of COVID-19 pandemic, providing immediate vaccinations and free healthcare assistance to those who are less privileged in each country in the world. Globalization takes place in the production of trade of various brands of vaccine in every country nationwide. The advocacy focuses in breaking the status brackets in priorities and give justice to the poor, applying them safety and relief while striving for financial gain. First, local governments might use calamity funds to subsidize food and water prices for the lowest segment of the population, particularly informal settlers, families living in densely populated areas. Safe and readily available water is very important for public health, whether it's used for drinking, domestic use, food production, or recreational purposes. Due to access and cost restrictions, disadvantaged populations are unable to obtain safe drinking water because proper hygiene is a challenge. The poorest and the most vulnerable are at risk due to a lack of access and high cost for safe water. Second, the resulting lockdowns due to the virus have created a significant downturn in the job market, thus exacerbating the impact of COVID-19 on the poverty in the Philippines. At the beginning of the pandemic, the Philippines' unemployment rate was decreased, but it is now worse due to the lockdown measures. Moreover, it could rise as the lockdown measure continues, leading to the increased levels of poverty and hunger. Given the widespread and still unfolding impact of COVID-19, the government has launched an emergency subsidy program to ensure that some low-income households have enough provision during the community quarantine. Existing programs platforms from Department of Social Welfare and Development and the Department of Labor and Employment will be used to deliver the emergency subsidy because speed is essential if the low-income households are to survive during the lockdown. Finally, it is important to work with poor communities to strengthen communications on hygiene and health promotion. Local governments, community groups, and the private sector can join forces to form a local network that could support poorest families in obtaining accurate and useful information on COVID-19, as well as provide free vaccination, immediate testing, quarantine, medical assistance, safe water, healthy foods, adequate sanitation, and hygienic conditions are crucial to health and well-being, more so on this time of COVID-19. In the midst of these trying times, let's do better and spread hope and positivity to our fellow to whom we digitally cross paths with. We must be unified and build strong essence of online empathy and respect. Let us stay safe, disciplined, and positive as we fight hand in hand. I believe that we will together overcome this crisis and heal. Let us make sure that no one gets left behind.